there's two reasons why I'm going to the rally today. One is for personal reasons for my own health insurance situation, and health insurance is really unaffordable for self-employed people or small business owners in the United States, myself included, and certainly beyond the small business self-employed person's world. There's just lots of people who have jobs where their employers don't provide them health care. A lot of the health insurance people have doesn't actually cover what they need, and there's lots of plenty of other examples of industrialized nations that have public health care options that work fine and cover everybody and cost a lot less to administer than our own private health care system as we have it set up right now.
I'm for a public option in health care, and I think everybody should have it. It's a right, not a privilege. I lost my job and I was denied health care because I had asthma and they wouldn't insure me. Now I'm on Medicare, best insurance I ever had. I'm well cared for and my premiums aren't sky high. Of course, the price of pills and so forth is very high, and Plan D doesn't really work.
I'm going to the healthcare rally today because I think it's important that everyone have access to healthcare. And right now, there's a federal law that makes it so domestic partners who are on each other's healthcare basically get penalized for not being married because they still have to pay taxes on the portion of the healthcare that's compensated from their employer or their insurance agency, which is not true for married couples. Married couples don't have to pay taxes on the parts of their healthcare that are paid for through their insurance or healthcare provider. And I think that that's really stupid, that being married makes it so you don't have to pay this extra amount of money, but if you're not married, you do. And then the other problem is that you have to choose. You can have like an adult dependent, which would be your partner, but you can't have adult dependents and kids on the same health care, so you end up having to choose between your lover and your kids. And again, married couples never have to make that choice. You can cover your husband or wife and all of your kids. Even if you have 15 kids, no insurer, would stop you from doing that. So I think the reason I'm here is to sort of make sure that everyone has access to health care, regardless of whether or not they're married, and that you should never have to choose between your lover and your children.
I'm coming out to make a stand about all the people that need health care. I've talked to a lot of people who aren't here today, who couldn't come, and so I'm here for them as well as for myself.
And why is healthcare an important issue?
Healthcare shouldn't be about money. It should be about what people need.
Right now, healthcare is for those who can afford it and those who can opt into it in certain ways. And the fact that 1 in 4, just in Maine, 1 in 4 Mainers aren't covered is huge and incredibly scary. And that's not the way. Like health isn't it's a right. It's a right that people are supposed to have. So.
Good afternoon, Maine. So I'm going to call off your county. Is there anybody in the house from York County? Is there anybody in the house from Cumberland County? That's easy. But what about Franklin County? Yeah. What about Oxford County? How about Lincoln County? Yes. Saginaw. Yes. Androscoggin. Somerset. Penobscot. Piscataquis. All right.
So do you feel like you're making a difference by being a part of this crowd? Are you excited about it?
Yes, ready to do our world. That's why I bring my son and my grandchildren.
Thank you.
And I was sitting with Shelley a little while ago, and she was doing a radio interview, and the reporter said, "Now, Congresswoman Pingree, aren't you worried that a public option would present unfair competition to the insurance companies?" And I said, I was thinking in my head, "Pal, you have asked the wrong question to that person." And she held back a little bit. I mean, she was restrained, but she looked at him and she said, "You know, my job is not to make sure that insurance companies make huge profits." She said, "My job is not to make sure that CEOs continue to make these outrageous salaries." She said, "It's my job to make sure that everybody has access to quality, affordable health care. And that's why I support a public option."
My partner actually is currently working a variety of part-time jobs and doesn't have access to health care. And my partner has Crohn's disease, which is a genetic and debilitating intestinal disorder, and weekly meds every week would cost $400 to $700, and that's crippling, especially, for the two of us. We can't afford to pay that together, and there's the only way for my partner's, for his condition to not be awful and terrible and increasingly worse, especially in old age, is to take this preventative medication, which, unless, there's universal health care, we're paying out of pocket for. And that's a very common story for a lot of people I know, and a lot of young people.
Patient's choice! Patient's choice! Patient's choice! Patient's choice! Patient's choice! Patient's choice! Patient's choice!
The government budget help the budget office determined that this isn't going to help the choice. It's already been
Patient's choice!
You from the news? Okay.
It's called public. It's called public. On a regular basis on a number of issues. I've done teleconferencing with them.
And my name is Michael. I'm from Brooklyn.
What are you guys doing as a pre-existing condition and you're denied coverage after you lost your job and you make more than what Medicaid provides? What do? Do you perform surgery on
There's no need to
yourself?
scream. We can have a discussion.
Do you perform surgery on yourself? Is that what you do? What do you do? What if you have a heart attack? You get treated at the hospital, but you still get a bill later on. They're mandated to treat you. So what do you do? What do you do?
How about if we just
What do you do?
don't treat the 20 million illegal aliens that are...
Oh, the illegal aliens. Oh, okay. That's your big thing.
Go to California and ask them about illegals.
Wow. So you hate people in general. Is that what it is?
I can't begin to tell you how happy I am to be here today on behalf of Senator Snowe. And on a personal note, having dealt with breast cancer in the healthcare system myself last year, I have to tell you, the time is now. I do have a statement from Senator Snowe, and I'd like to read that if I could. We can no longer be a nation that spends more than any other, yet leaves 1 in 4 of every citizen without comprehensive care.
We're hoping to really push Snowe. She's leaning more and more towards supporting the public option, and if we can push her in that direction, then hopefully we can make it so Maine, which is already an incredibly progressive state, is the leader in terms of making sure that there's a public option.
I believe that the reforms we are creating will result in more competitive, affordable, and innovative options for Mainers. Yet we can all agree that we must not leave universal access to chance. That is why I also support a public plan which must be available from day one. To secure for our nation that which every other developed nation already embraces, the provision of health security for all of its citizens. The time has long come, and I promise you I will continue to work to move heaven and earth to make it happen.
I'm talking about my health care. My baby's got the blues. She needs to see the doctor, but the HMO refused. I'm not looking for a handout. That would make me feel ashamed. But since I lost my health care, brother, can you spare me some change?
Healthcare costs must be low! Healthcare costs must be low!
On the stock exchange, they're CEOs of millionaires, while we're just begging change.
And in terms of when Washington passes health care, I can only speak from my experience in Maine. Letting a bold reform sit out there through 4 to 5 weeks of the August congressional break could be the death knell. It means 5 weeks of the lobbyists picking apart healthcare reform. It means 5 weeks for big industry groups to harp on members of Congress, mislead the American public, and slow down, or even ultimately stop real reform. We need to encourage Washington to get it done, and get it done soon.
Private health care. Brother, can you spare me some change?
I'm a nurse. I've been a nurse for over 20 years, and I have been working on national health care for that length of time. It's wonderful to see this much excitement and people finally talking about this issue, which is an incredibly important issue. I think the most important issue hitting our country at this time.
I have enjoyed these events tremendously. Very inspirational. Everybody is, there's a lot of energy and a lot of positiveness surrounding this issue, which is wonderful. And it's great that everybody has shown up in such a great amount that they did today. And everything is just, it's wonderful and it's exciting.
We need some friends in Congress. Brother, can you spare me some change?